At the nursing station, a nurse carefully documents patient information, maintaining detailed records of the shift's activities. The outgoing nurse greets her colleague arriving for the next shift, preparing to transfer responsibility for patient care. During the handover, the departing nurse provides a comprehensive briefing detailing each patient's condition, prescribed medications, and specific instructions from the attending physicians. The receiving nurse reviews the handover sheet, though his wandering mind misses the essential details. The interruption continues as he receives a phone call, briefly shifting his focus to communication duties at the station. Even after finishing the call, his mind remains distracted, failing to notice an attendant urgently approaching until she reports his patient needs immediate attention. However, as the nurse is occupied with the crash cart, another attendant arrives with increased urgency, emphasizing that the patient's condition is deteriorating and requires prompt intervention. In bed 6, Mr. Daniel, diagnosed with DVT, is scheduled for prophylactic heparin administration. In bed 7, Mr. Yusuf, preparing for surgery, needs Valium to ease preoperative anxiety. With their care plans in mind, the nurse begins his medication rounds, walking through the ward with his tray in hand. Arriving at bed 6, he prepares Mr. Daniel's medication, heparin for blood clot prophylaxis. But distracted and unprepared, he commits a critical error, drawing up Valium instead. At bed 7, he prepares to give Mr. Yusuf his preoperative Valium. Still oblivious to his error, he administers the heparin meant for the previous patient, completing a dangerous medication swap. Minutes later, Mr. Daniel in bed 6, who received Valium instead of heparin, begins exhibiting concerning symptoms. He displays confusion, inappropriate smiling, and uncontrolled movements of his extremities, clear signs of unexpected sedation. But the tragedy doesn't end there. In bed 7, Mr. Yusuf faces an even graver crisis. Having received heparin instead of Valium, he begins bleeding heavily. An attendant rushes to his side, desperately trying to wake him, but he remains unresponsive and unconscious. The medical team responds with emergency intervention. Protamine sulfate reverses the heparin's effect, stopping the bleeding. Mr. Yusuf stabilizes and regains consciousness, but this preventable error nearly cost him his life. Later, the senior nurse initiates a crucial debriefing, reviewing the systematic breakdown in safety protocols. Today was chaotic, but that's when our training matters most, he explains. The 5 rights aren't optional. They're the foundation of safe practice. The conversation is firm but constructive, focused on preventing future errors.
Which of the 6 rights of medication administration were not followed? First, he never verified what he was giving. Right medication, not followed. Second, he never confirmed who he was treating. Right patient, not followed. Third, he never documented what he'd done. Right documentation, not followed. 3 simple checks. 3 deadly omissions.